Hi, everybody. My name is Lynn Sickwillen, and I'm a member of the Public Education Committee of the Anxiety and Depression Association of America. Welcome to our webinar, Marijuana and CBD, Benefit or Harm for Anxiety, and our presenter, Dr. Robert Yieldling. These webinars are presented by the Anxiety and Depression Association of America, which is the leading nonprofit organization in the field of anxiety and depression. Our mission is to improve diagnosis and promote the prevention, treatment, and cure of anxiety, depression, and stress-related disorders through education with webinars like this one, practice, and research. Please take advantage of the amazing resources you'll find on our website, adaa.org. You'll find a great list of treatment providers by just clicking on Find a Therapist from the home page, as well as a free peer-to-peer online support group. If you have any questions after watching the webinar, please feel free to send an email to webinars@adaa.org. And finally, you can support ADAA by making a charitable contribution on the website. Okay, let's get started. I'm really happy to introduce our presenter, Dr. Robert Yieldling. He's a clinical psychologist who is currently practicing at the Anxiety and Depression Center in Newport Beach, California. Dr. Yieldling earned his doctorate in clinical psychology from the California School of Professional Psychology. He is a diplomat of the Academy of Cognitive Therapy, and he currently serves as a board member for the National Social Anxiety Center, which is dedicated to fostering evidence-based treatment for social anxiety. Dr. Yieldling specializes in helping adults and adolescents with depressive and anxiety disorders, specializing in treating social anxiety, insomnia, panic disorder, OCD, and managing and finding growth in life transitions. He uses cognitive behavioral therapy and mindfulness strategies, proven strategies that provide results. See his website at anxietyanddepression.com. Now let's turn it over to Dr. Yieldling.
Thanks so much, Lynn.
You're welcome.
Okay, great. So yeah, thanks again. I'm excited to be here and talk about this subject today as it comes up often in our team meetings and client sessions as well. So I'm going to be talking about marijuana and CBD and discussing kind of the pros and cons, benefit of harm for anxiety.
Can I just, I think.
Let me see. Okay, there we go. Did the slide move for you?
I think go ahead. I'm not sure if it's the view we want, but go ahead. I think it should be fine.
Okay, sounds good. So starting off, I'll just kind of give a general landscape of anxiety as well as cannabis use in the States right now. So anxiety disorder prevalence worldwide, an estimated 284 million people have an anxiety disorder. And by anxiety disorder, and in general, that means either generalized anxiety disorder, GAD, panic disorder, social anxiety disorder, or a specific phobia. So an estimated 31% of US adults experience one of these disorders in general at some time in their life. And an estimated 19% of US adults have had one of these anxiety disorders in the past year. Not on that list is PTSD, which used to be categorized as an anxiety disorder and certainly entails a lot of anxiety. But I mentioned that because there will be some tie-ins later, especially in regards to CBD and some potential research around PTSD as well. So we'll kind of have that in mind. Okay. So here's the latest graph I could find in terms of where the US is at in terms of legalization and different programs using cannabis. As you can see, 36 states and 4 territories have now passed some kind of law legalizing cannabis. This could include THC-based cannabis or medical marijuana as that, or CBD, all of the above, these 36 states. 15 states and 3 territories have adopted laws legalizing marijuana or THC-based cannabis for recreational use. And this has really been increasing exponentially since about 2012. And you can kind of see, looking at our country here, how widespread it's becoming. And there's this real contrast at this point between what's still the case at the federal level, which is essentially, at least on the books, viewing it as an illicit drug, and what's the reality for the bulk of our country at this point in terms of using it medically in some form, or even beyond that. Okay, so I thought I'd start off just with kind of some vocabulary, because even I get kind of confused with all the different terms and what's what and that kind of thing. So for viewers who maybe aren't too familiar, the base of what we're talking about is the cannabis plant, which has several different strains. Most often, or the ones you'll hear about, is cannabis sativa or cannabis indica. And within that cannabis plant, there's groups of different compounds, chemical compounds. And one of those groups of compounds is the cannabinoids. And this is going to entail both the THC compound, which is the well-known kind of psychoactive compound that leads to the different effects of intoxication you've heard of, kind of, et cetera. A different group of compounds is the cannabidiol, or CBD. This is the most abundant cannabinoids compound group in hemp, but it's also in the cannabis plant, or cannabis sativa. But it's non-psychoactive. It doesn't lead towards the high or the different psychoactive properties that you might traditionally think of in marijuana. So it's been extracted and it's singularized and used for different growing health purposes, as we're going to talk about. The term marijuana itself is probably, maybe the most confusing here, because it kind of means different things at different points. Marijuana can mean the same thing as just the cannabis plant, the marijuana plant. Or more often, it's probably used as meaning a THC-based cannabis product. Marijuana, something that has THC that's used, and you're going to experience the psychoactive effect, or kind of a high from it.
So CBD can't make me high.
CBD can't make you high, correct. In general, it shouldn't. But as we'll kind of talk about, it is a really important point, actually, that comes up, is how we don't really have the exact science and practice of ensuring the CBD purity and dosage. Mm-hmm. So if you went to a common dispensary and bought CBD right now, not knowing much about it, you don't really know how much THC might be in it. Mm-hmm. Some CBD products have a fair amount, up to 3, 4, 5% of THC in it, and it's just labeled as CBD. Another one might have some minimal amount that's negligent, has 0 in it. So part of the issue we're facing right now is exactly that. We don't totally know exactly what contains what in a very regulated, trusting kind of way. So CBD, something labeled as a CBD product, in general, shouldn't contain at least too much THC that would have an effect, but that's not something
you never know
yet at this point. So that's kind of an ongoing, challenging question. Okay, so let's take a look at the cannabis use numbers in the states. Prevalence has been increasing along with that graph that showed legalization increasing. Prevalence of use has been increasing pretty steadily. There's been a 45% increase from 2007 to 2014. More importantly is the increase in what's called heavy users. These are individuals who would use cannabis daily or near daily. That's kind of what we're going to talk about as a heavy user, or beyond daily, multiple times daily. That's going from 1 in 9 to over 1 in 3 from 1992 to 2014. So that's a big increase. That means that the use among users, within the use among users, the bulk of cannabis consumption is increasingly becoming concentrated around a smaller number of heavy users, more and more, as time kind of progresses here.
And maybe you're going to get to this later, but there's often been a distinction that when they talk about a reliance or addiction is that there's a difference between the daily user and the recreational user in terms of impact. And I don't know if you're getting to that later or you might.
Absolutely.
Okay.
Yeah, absolutely. Most of these kind of real serious impacts we're going to talk about are going to be connected to this general term heavy user, like you're saying, and that,
Okay.
that frequency of use. Yeah. Which ties right into the next point here, which is that quote unquote self-medication or using cannabis in a way that's beyond infrequent recreational and is used in a way to regulate or modify your mood or your affect habitually and this kind of thing. Using cannabis or marijuana in that way in states with legalization among individuals with anxiety and mood disorders is the highest.
Mhm.
So what that means is in states like mine in California, the rates of people who are using marijuana in a way that's self-medicating habitually is higher than states that don't have this legalization status quite yet. You can, guess about different reasons why that might be. There's certainly the proliferation of the legalization happening. There's dispensaries popping up all over all over the place. There's even delivery points that can knock on your door and kind of deliver your cannabis in that kind of way without even having to go out or drive or go anywhere. They're shifting public perceptions around it. It's increasingly seen as less stigmatized, as having more of a therapeutic value. It's an all natural means towards health, so to speak, is kind of what the perceptions are shifting towards. And there's reasons they're shifting in that direction, but the reasons aren't necessarily based off the research we have available yet. So there's something going on there that we can kind of dive into a little bit. Okay, let's see. Okay, here's an example. So I just did a screen grab off of a common cannabis dispensary website. And this is the kind of marketing that you'll be likely to find pretty easily that related to THC-based cannabis at this point. This one kind of says, conquer your social anxiety. And you can see 6 different products of marijuana on the bottom there that they're kind of advertising as being the helpful therapeutic ones for social anxiety. So there's this marketing and social shift towards really viewing this thing as, kind of, micromanaging your high and using this for social anxiety and this for insomnia anxiety. And this, this product's going to be for that. And this is kind of the social and commercial atmosphere that's happening and has been happening, for a while now, that we're going to see as kind of way over here, but in contrast to the actual research, which is still kind of way back here. So this is just kind of give a sense of what people are actually seeing, what they're looking at when they're buying their products and the way they're thinking about using cannabis before they're coming into your office or kind of on their own. This is kind of the focus out there right now. Okay, so as we know, cannabis use is increasing and more people are using marijuana and CBD to help with their anxiety symptoms. So let's look at some numbers around this. Anxiety ranks among the top 5 medical symptoms that North Americans report using medical marijuana for. A big study in 2019 found that more than half of US adults perceive cannabis as having a medical use, that's THC and CBD. Here's the important one though. Results show that approximately 29 to 30% of THC marijuana consumption was used to reduce stress and anxiety. So something's big's going on there, that the THC, this is marijuana being used that frequently for the number one reason, being stress or anxiety. Participants reported using CBD to replace medications, to reduce pain. There is evidence supporting that. Stress and anxiety, and for better sleep. And THC, again, was used most to reduce stress and anxiety.
And isn't anxiety one of the ones on the list for medical marijuana approval, kind of?
Well, I'm going to go into in a little bit more detail. But
Okay,
at
go
this,
ahead.
yeah,
Yeah.
sure. I'll get there. But at this point, no, not, evidence, at least THC-based marijuana, not really indicated, as having a lot of research to back it up. Okay, so this is kind of a surprising result, like as you're asking, because this marijuana has gained this kind of widespread approval. And a lot of people think that as a treatment for mental health conditions. And it's been legalized for many therapeutic uses, pain relief, these kind of things, nausea, different diseases. But the research isn't there in terms of anxiety, and stress, but it's being used in this way. So what's going on? So what does the research actually show? Like you're asking, should I be using marijuana? That, again, this is THC-based cannabis products for my anxiety. At this point, scientific data does indicate the potential therapeutic value of, or I'm sorry, does, one second, my screen got blocked here.
Mhm.
That should say.
It is
okay.
up there.
Okay, yeah. So scientific data does indicate the potential therapeutic value of cannabinoid drugs, primarily THC, for several things: pain relief, control of nausea and vomiting, and that being correlated to different kind of diseases and these kind of things, and appetite stimulation, especially in patients who might be undergoing chemotherapy or these kind of things, can be very helpful for these things. However, a recent comprehensive review did not identify any really good quality literature that reported cannabis as an effective treatment for anxiety symptoms. Again, that's THC-based cannabis. Beyond that, frequency of use is associated with increased anxiety symptoms and future incidents of some problems, in particular, social anxiety disorder being one of them. And we'll look at some more examples of this. Okay, so despite the state of this research, the public clearly reports using cannabis to reduce anxiety, and it's increasingly viewed as an adaptive way to cope. So why might this be? One big reason is that low doses of THC do reportedly engender anti-anxiety effects. This does happen out there. You do see this, and like you're saying, a lot of people are going to report this, and it's true. Low doses are going to probably, in most people sometimes, reduce anxiety and offer kind of a relaxing effect. However, as I'm sure everyone kind of knows, you got to be careful, because higher doses will do the exact opposite. And they can often very commonly lead to increased anxiety, panic,
Paranoia kind of feeling.
Many people who I might meet with who describe their first panic attack, kind of describe something like this, of having too much THC or being dehydrated and using THC and these kind of things. So there's kind of this paradox with it, where low dosage will probably be relaxing, but higher doses are going to really totally do the opposite. More importantly than that is that heavy use and chronic use, like those heavy users we were talking about, who use daily, every other daily, especially to regulate mood and affect, it's going to build up in their system, and there's going to be a sort of a dependence that happens where when they stop using, or when they're no longer intaking THC, there's likely going to be some withdrawal symptoms. There's going to be anxiety, altered appetite or sleep. There's likely going to be irritability, or kind of an irritable mood and irritable depression that can kind of develop. And these are going to be very uncomfortable things. And if the very reason that they were using THC was to kind of modulate some of those aversive feelings, here they are coming back tenfold when they stop using, what's going to happen? Further use. So they're going to get caught in this cycle of kind of using it, but it could become self-perpetuating of these very issues that they were looking to find help with around it. So this is kind of partially what explains kind of this discrepancy between what the research shows and why it's so often viewed as a way of helping anxiety, because a person might go through a particular night, or moment and use it in a way that truly brought their anxiety down, or they were able to cope with a social situation, and they got through it by using it that way. But there was kind of the devil in disguise there, and that they were actually not ultimately helping themselves through something like an anxiety disorder by using it in that way. It was actually exacerbating the problem.
A lot of my clients say, I had my social anxiety, but this helps me get out the door and helps me be social. And so what's wrong with that, right? If I can't, get out without it, what should I do? What am I supposed to do?
Bingo.
Mm-hmm.
And they're probably right at the outset that it does help them to get out the door, right? Mm-hmm. I mean, it probably does kind of shift their mood or affect or physiology or thinking, and they're able to get out the door that day by using THC, using marijuana. But is the disorder, is the social anxiety decreasing over the long run in the course of their life? Mm-hmm. Or is what's actually happening is they're using it temporarily in that way, but perpetuating the need for further use of it in that way, and missing out on the opportunity to do something different, which is, of course, what we do, in developing skills like in cognitive behavioral therapy and finding alternative ways of identifying and altering and facing that fear in a way to truly tolerate it, and overcome it. They're kind of staying in the same place by using it to get out the door that way.
Have you ever thought it can be combined in some way to meet the needs?
Well, I think when it comes to THC, probably not. But as I'm going to get to, there's potential, too early to say, but maybe, using some combination with CBD might be more effective as kind of a combination. I'll talk about that more in a bit.
Okay.
But I wouldn't recommend it in terms of THC-based cannabis products. Okay. So we're kind of, this is good because we're kind of already talking about this, but this is, these are just some screen shots of a Twitter feed I was randomly scrolling through at some hour of the night this week. And the thread was around anxiety and cannabis. And this just kind of shows some of the, at times humorous, but kind of perspectives of how people are thinking about cannabis use for anxiety. So this one person says, indica makes me so tired that I don't get anything done, and that gives me more anxiety. Or another person wrote, I prefer sativas, so I can blame my anxiety on the weed instead of myself. Or another person wrote, just like you said, sativa is the only thing that gets me out of bed and allows me to talk to people without fear. Mm-hmm. This person says, oddly enough, I have an anxiety disorder, but indicas make me more paranoid, so I prefer sativas. Is that weird? Question mark. So these kind of show a couple points to me. On the one hand, it kind of shows that in terms of someone who wants to say, is sativa the good thing for my anxiety? Is indica the good thing for my anxiety? What's the right way to take it? What's the good one? There's no real answer. Someone might tell you there is, but depending on the person, the situation, other compounds involved in what the product they're taking, there's not anything close to a scientifically based answer to the right weed for you in any particular moment or situation. And the other one, it kind of shows how people are thinking about it, though. This kind of is like, yeah, this is that research we saw, that people are perceiving THC, perceiving cannabis in this way that they can kind of fine tune and is going to be helpful for their anxiety. But again, we're kind of recognizing the problems and challenges with that kind of approach to it here. Okay, so we'll go from Twitter to this more academic theory-based model here. This is by Buckner and his colleagues. And what this is just kind of a little bit more detailed and nuanced theory around this general idea of self-medication. So this is a model for people with social anxiety disorder, what the motivation for cannabis use or substance use, would be. So for example, one person might want to smoke to get out the door to be able to socialize. And there might be multiple layers of that. They might be having many thoughts before they walk out the door of, how am I going to look? Am I going to be judged? is something bad going to happen? Am I going to know what to say in this social interaction? Am I going to get rejected? They're flooded with these negative, aversive, anticipatory thoughts. So by smoking or using the THC before walking out the door, what happens to those evaluation fears? They're just kind of able to be numbed out.
Who cares? Yeah.
Who cares? I don't have to think about that anymore. And that's what it's doing. Or maybe the person's starting to feel incredibly nauseous, or their stomach's becoming upset because of the anxiety before walking out the door. So what does smoking do? Oh, it calms their digestive system. So they're managing their physiological arousal in that moment before walking out the door. Perhaps it's to avoid social evaluation or some kind of negative social judgment. Oh, everybody else is, doing it, so I'm going to avoid any negative social evaluation. It might facilitate their social confidence in some kind of way, or it might just increase positive affect. So there's multiple layers. And if you're working with someone or even, someone kind of learning this for themselves, you want to think about in detail, okay, what's the function of this use for me without any pressure or judgment around it, starting to think and observe how and why and what function is this serving, or multiple functions does this serve in a particular kind of way. And do I want to set myself up to create a dependence on this substance to manage this component here? Or, if I want to find, I'm involved in, treatment or therapy, or find help on your own or self-help, it's like, how can I know these functions and look to develop alternative skills to manage these evaluation fears, manage that fear of judgment, manage my physiological arousal? What other pathways of targeting these components can you find for yourself? And that's kind of how I would, approach someone with this challenge here. Okay, so in summary regarding THC, dangers of overutilization, particularly in heavy users for coping motivated cannabis use. That's kind of would be my main thing to focus on and take away from it. The dangers it can create would be leading towards, like I was just talking about, to psychological dependence. It's going to interfere with the possible learning that could happen by not using it and learning how to cope with those feelings and get out the door anyway, which ultimately over the long run is going to maintain the symptoms of anxiety. It can exacerbate the symptoms over time, like we were saying, through just maintaining the course of the disorder and even exacerbating physiological kind of withdrawal symptoms. Could potentially lead towards greater reliance on the substance or even an overt substance use disorder. And there's especially high risk around chronic use in adolescents. There's new research.
Are you going to say more about that? I see a lot of that in my practice. And they're smoking alone and often to go to sleep or at the end of the day, rather than in the socially anxious kind of situations of going out there. It's kind of isolated, alone use. So.
Yeah. Especially if there's an adolescent who's in this kind of high use, daily to every other or more, then there's even some more recent research about how dangerous kind of the long-term associations are with that. Things like depression, earlier onset of psychotic symptoms, suicidality. These are the things that are being linked to intense adolescent use. This is the time where the brain is still developing during adolescence, and using THC with that frequency around that time is going to alter the wiring. It can even impact, there's some studies can even impact IQ scores, permanently, using it that frequently around adolescence. So if there's one thing to highlight to be wary of and intervene and trying to find alternative coping methods for, it would be, that kind of use in an adolescent. Okay, so not necessarily encouraging therapeutic news for cannabis when it comes to THC-based products, but certainly some understanding of the nuances of it, of how it works, and the dangers of it to be aware of. How about cannabidiol? How about CBD? What does the research show? Can I be using CBD for my anxiety? Well, as in terms of right now, that same comprehensive review found limited evidence that CBD is effective for anxiety symptoms. However, in terms of this study, limited is something. These are kind of stringent terms that they use to define it. Basically, it means that it's brand new. The research is picking up the past couple of years, but it's still really in its infancy, and it's not grown to the point of having firm recommended, proven recommendations for anxiety at this time. That being said, let's look into a little bit more detail on what some of these very initial studies and the directions they might point us in here. And again, we're talking about CBD. So this is now the non-psychoactive compounds of hemp or of cannabis, not the products that are going to be giving any kind of high, shouldn't be at least. That's kind of what we're talking about now. Okay, so starting off, there was this one study that showed CBD was shown to reduce acute anxiety assessed by a public speaking test in patients with social anxiety disorder. So what happened was there was a group of patients who had social anxiety, and they were kind of impromptu giving this performance task of giving a public speaking activity, which of course would induce anxiety, for people who had social anxiety disorder. And the group that was given CBD right before acutely was shown to report that had an anxiolytic effect, an anti-anxiety effect. They reported less stress, less anxiety giving that public speaking test versus the people with social anxiety who didn't receive the CBD, who received a placebo. So this is these were kind of some of the initial studies, is what they're showing, that acute administration, at least initially, it does lead towards kind of the subjective reduction in anticipatory or performance anxiety regarding, at least most of them are around social anxiety as an example of anxiety, but it's kind of showing this overall anti-anxiety acute effect that it will kind of play. And there's a couple studies showing that, at this point. So that's interesting. Let's say these are going to continue, and the evidence is going to build around it, and we're going to kind of find that maybe CBD does offer this calming acute effect. And that's something that's interesting. But even with that, I would say there's a difference we want to be aware of between what's helpful with reducing acute anxiety and what's actually helpful with something like social anxiety disorder, the course of a disorder. So we want to think about everything in context. In CBT, we're always looking at what really needs to change. What are the maintaining variables that are contributing to this disorder being maintained over time? And one of them is typically avoidance of feeling anxiety, avoidance of feeling anxiety in social interaction situations. And again, if we're taking something to reduce that anxiety every time habitually, then we're still not going to necessarily develop the skills or shift in thinking or coping confidence that's going to actually relieve something like the whole disorder over time. So it's interesting, but we want to be kind of careful. Just based off of these, I'd say, if you have something every now and again, like a speech or a presentation or something like that, and CBD is used every now and then to kind of reduce it, or perhaps if it was for anxiety around falling asleep, if you used it once a month or periodically like that, and it did have that calming effect for you, then that might make sense. But on the other hand, I would argue the same principle applies, that falling into using this habitually, this is what I'm relying on to feel less anxious. And without that, those fears of mine are still just as real. You're not going to tackle what really needs to be tackled to overcome, something like a social anxiety disorder or a panic disorder or something like that.
But if it lets me get to the party, doesn't it kind of wear off and I still have to use my skills once it wears off?
You will still have to use your skills once it wears off. Yes, I would imagine you'll feel your anxiety will jump right when you notice it's starting to wear off, and that might be a challenging scenario. So yes, it is good that it gets you to the party, and that might be an interesting way of potentially using it. If we were working with someone individually, and that's kind of how we conceptualized and planned for it, And the commitment was to still be there and use your skills or have an exposure to do something at the party. Perhaps it's better to get to the party with in that way without other than kind of not getting there at all. You know, if you can
Yeah.
test that out and it would still be productive by the end of the night, possibly. But on the other hand, if we always need CBD and there's no growth beyond that, if it stays like that, then probably not. But if it's in the service of building that exposure and confidence, and eventually you commit and don't need it to get to the party, then yeah, maybe that would be a potential, you know, you could kind of work out with. I'd want it to be in a very individualized, you kind of plan, you know, doing that with someone, but possibly. Okay, good. So this was another study, a little bit different. This study looked at adolescents, 18 to 19-year-olds in Japan who had social anxiety. And this was different from those other studies because this actually was over the course of 4 weeks. And the individuals with social anxiety were just taking the milligrams. I don't have the exact dosage off the top of my head right now, just once per day over the course of 4 weeks, compared to individuals with social anxiety who didn't take the CBD. And you can kind of see these are two different social anxiety scales, the two graphs. And you can see on the one on the left, the blue bars, you can see the individuals who are taking CBD once per day reported a significantly decreased symptomology of social anxiety over the course of those 4 weeks. Same with the different social anxiety, the Leibowitz social anxiety scale on the right. Individuals taking CBD once per day reported less overall social anxiety over the course of those 4 weeks. So this is a little bit more interesting because it's not necessarily just taking it in that acute moment of performance or anxiety, it's taking it kind of overall, a little bit more chronically, which is encouraging that it's kind of showing these results, but there's still no long-term follow-up on the study beyond those 4 weeks. So we don't really know what happened continuing after that, or if the CBD use stopped, what happened from there. So still kind of an initial study, but interesting and good in the fact that it was a little bit more of a chronic kind of use, versus more acute use. Okay. So here's some other interesting studies with CBD. There's some initial evidence that CBD can enhance what's called extinction learning, which means it might serve, like you were asking about, and we're kind of hinting at here, in the future, it might turn out to serve as a potential adjunct to behavioral therapies, exposure therapies, like what happens in CBT or behavioral therapy for anxiety disorders. So what this kind of means is that adding CBD to a behavioral kind of relearning process. For example, say someone was afraid of heights, and in order to conquer their fear of heights, they wanted to try to extinguish or create extinction learning around that fear or that conditioned stimulus. So what they're going to do is we're going to expose to frequent and prolonged situations that involved kind of a progressive facing of fear of heights scenarios. And what this study kind of demonstrated is that doing something like that, but administering CBD, even after some of that extinction learning had occurred, so after those exposures had kind of shifted some learning, that enhanced how strong that extinction learning progressed. So what that means is that enhanced someone's ability to feel diminished anxiety around fear of heights as an analogy, but a situation like that, this enhanced the learning to say that doesn't have to be as much of a threat for me. And that's over the course of time. That's kind of more longer term. So this is really where I get interested in the potential of it, because it might be able to find a way. We don't know exactly the timing or the dosage or how yet, but there might be ways of it being able to enhance already proven evidence-based strategies to habituate to fearful scenarios, or whether it's kind of a phobia or whether it's something like a trauma from the past, connecting it back to PTSD. There might be something there that helps reorganize the memory and the learning, or enhance it in ways to start to feel less of a threat response to these built up fearful scenarios that people experience. So another study kind of showed a similar thing. CBD may help produce an enduring reduction in learned fear expression when given strategically along with behavioral treatment. So it's very initial, it's very early on, but could be this helpful contributory effect that CBD might play along with something like traditional behavioral exposure strategies to decrease fear expression to things like feared social scenarios or feared past traumas or feared phobias, or we might be able to find these areas where we can apply this. And the benefits of it, I mean, to learn more about exactly how, but the benefits of it really might help in the future to develop stronger treatments, in terms of other proven behavioral treatments for anxiety disorders. So these are kind of the fascinating studies for me about the potential of this, and if we can get the studies going further and further, where this might more nuance it and get some actual guidelines of direction, what this actually might look like. These are kind of the exciting parts of it from what I'm seeing here. Okay, so let's kind of summarize a little bit the picture with CBD. Most current studies, again, still examine more acute single CBD dosing in healthy subjects. So further studies are required to establish whether chronic dosing of CBD has similar effects. Well, we still need to get more studies around that. But overall, the summary reviews really emphasize the potential value of CBD in treating anxiety disorders. But I need to add to that, we're nowhere near knowing exactly, how, when, and having a protocol for it. So there's need for further study of CBD in the treatment of anxiety disorders. And what really needs to happen is we need to develop and standardize dosing studies to inform, what the dosing strategy is going to be exactly, which means how much, when, for which disorder and which situation, for which patient, et cetera. Again, we still don't really have a clear way of determining the purity of CBD, that we know we're getting CBD and the right one and the right dosage. It's like we need to have ways of straightening that out. But if we can kind of move in that direction, we'll be able to determine, what CBD's place as an alternative, or again, supplemental therapy to other evidence-based approaches like CBT. So it'll be interesting and fascinating to keep a watch and see how this research and the subject progresses here. Okay, so again, here's my information, and if there's any, of course, follow-up questions, feel free to get in contact with me, and I'll be happy to share what I know and what I learn more in the future.
Dr. Yielding, a number of people talk about using CBD for sleep and even ask about giving their kids a CBD for sleep. What do we know about it helping sleep, which is commonly going on with anxiety?
Yeah.
Depression.
Well, I think what the studies are kind of showing is that it does offer some of that, probably at this point, the only reference would be some of that acute anti-anxiety effect. So if anxiety is the thing getting in the way of the sleep or falling asleep, then it very well could offer kind of a short-term benefit of decreasing that anxiety, which might allow someone to fall asleep, easier. But I'd offer the same cautions with it, that using it in that kind of way, it might be better than the other prescribed sleep medications out there, in the sense that it might have less side effects or potential for tolerance or addiction or other kinds of things. Yeah. But it still might not get to the heart of what you need for enduring skills and strategies, or get to the heart of the problem for what's kind of driving the insomnia. So it might help in the short term, but I wouldn't recommend using it habitually at this point still, or coming to rely on it, or use it as a substitute for other great treatments that are still available out there to use that, between CBT and mindfulness-based approaches and sleep hygiene. I would go to these places first, certainly, to try and develop it. In terms of children, I wouldn't recommend that now. I think there was like one anecdotal study I found around using CBD for insomnia in a 10-year-old, but the studies are just kind of nowhere near frequent enough to kind of recommend around that for someone, at that age, certainly. So I would stay away from that.
And if I find marijuana helpful for me, how can I help not get dependent on it?
Well, when it comes to THC, and marijuana, using it in that way, do your best as soon as you can to kind of start to do what I was talking about earlier. Start to really look at and understand the function of use that it might be serving for you. And if it's going down that road of leading towards kind of the quote unquote self-medication, or using it to modulate affect or anxiety or these other kinds of things, then it's going to quickly go in a direction that's going to exacerbate the problem. So I would recommend, as soon as you can, becoming aware of that, trying your best to only use it in ways that aren't fulfilling that function. So, if you're using it recreationally or to relax or enjoy or whatever it is sporadically, then that's another thing. But I would recommend trying to alter the function of the use, or if that's a real challenge to do and you're kind of find yourself lacking the skills or ability to kind of do that on your own, that would be the point in time where I'd recommend kind of reaching out for help. Whatever that's going to look like for you, social help or friend help or therapeutic help. That's the time to really say, wait, there are other skills and proven strategies I can develop to learn how to get out the door, or to regulate this feeling, or to cope with this situation. Let me try and explore those sooner rather than later, before the self-fulfilled increased problems develop over using THC in that kind of way. So that would be, that'd be what I'd recommend for it.
And I know everyone's different, but if I'm a parent and I know that my adolescent or young adult is kind of using daily and using, as I said, alone, what does that usually serve in your clinical experience, when there's daily use, but it's really kind of solitary and not when facing, anxiety provoking or difficult situations?
Yeah. It might not be related to a function of use for anxiety in that situation. It might be. It's probably not a social anxiety or something like that. Maybe they're just kind of using it on their own to regulate their mood, or their affect in some kind of way. Or they're trying to regulate, perhaps a depression by increasing that positive affect or that numbness or whatever that's coming along with it. That would be the questions I would probably see as likely or look into. So you'd want to kind of formulate and kind of dive into, trying to individually find the answer to that question with each person, with each client. I stay away from blanket kind of assumptions of why it's happening.
Right.
Try and dive into the details of what the actual thoughts and motivation and what it's actually doing. It's a great question. That's what we exactly need to find out for every person we're talking to, is specifically what it's doing. Is it shifting? Is it numbness? Is it shifting mood? Is it avoiding something? That's all great, helpful information to start to understand and try and work with to find more helpful avenues to meet that need.
And one more question: if do you know anything about taking CBD along with other medicines?
Not much research I'm aware of on that too much, other than it can potentially interfere with some things, but not that I've seen as being too much yet in terms of major red flags with it. But I don't think the research is available that I know of, or that I've seen, to really give a strong answer on. I'd still be careful, for sure, if you're taking other prescription medications or psychotropic medications. I would certainly talk to my psychiatrist around it and not just start taking it, that kind of thing, potentially. But I'm not too aware of specific, research on it.
Well, thank you, Dr. Euling. This has been very helpful. Is there anything else you wanted to add before we finish up, in addition to your presentation?
No, that's it. Just to be excited to keep an eye on the research, but to remain patient, as the gap between the legality and the social scene of it is much farther ahead of the research right now. So just to be aware of that gap and to be skeptical and patient before we catch up to actual real, kind of recommendations for this, but to be excited about CBD and the potentials at the same time.
Well, thank you very much.
Thank you. My pleasure.